In other news, 194 member states convening in Geneva, Switzerland for the 76th annual World Health Assembly meeting under the theme, Saving Lives, Driving Health for All. The official opening took place today. Health and Wellness Minister, the Honorable Dr. Michael Darville, is leading the Bahamian delegation that includes officials from the Public Hospitals Authority and the National Health Insurance Authority. Universal healthcare coverage is cited as a major pillar of the Geneva discussions, as the World Health Assembly's intention is to put in place global coverage by the year 2030. Darville says government equates the provision of healthcare services with equity across the Bahamas as priority. This, he said, will become evident when Parliament moves on new legislation to repeal the old National Health Insurance Act.
Bahamian people can recall that I have the National Health Insurance Bill that I laid in Parliament to repeal and replace the 2016 Act. The reason why that's important is because we want to expand services for primary health care throughout the Commonwealth. In order to do so, the old piece of legislation hindered us with that task to be able to do it. And so this new piece of legislation gives us more tools and more leverage to implement new services, specifically with screening. We intend to screen for colon rectal cancers, we intend to screen for breast cancer, and because of the tertiary healthcare facilities being in Nassau and Grand Bahama, it's very important for us to come up with a strategy so that we do not leave the family islands out.
Citing non-communicable diseases, the COVID-19 pandemic, and antimicrobial resistance as hot-button agenda items, Darville said with the impending 2023 hurricane season, the focal point for the country will be climate change and its impact on health and wellness. He also commented on the recent groundbreaking event for the new Freeport Healthcare Campus.
1A is a 60,000 square foot structure that will have a lot of outpatients facilities and to be able to be functional within 18 months. This is compounded with phase 1B, which is to design emergency beds and to turn the facility into an urgent care facility. That will be completed and usable as the phase 2 project is ongoing, which is the multi-story facility that will produce the necessary bed and further diagnostic equipment. And hopefully once that's completed, we will downgrade the Rand Memorial Hospital into a secondary facility where we would provide geriatric care, psychiatric care, and we have 2 beautiful theaters there which would be used for outpatient surgical procedures.
Digitization of healthcare services will also receive attention at the meeting, something the Bahamas government sees as beneficial for future development.